Good morning, everyone. Thank you so much for joining us for this third in the series of the Faculty of Public Health's Distinguished Lectures. This is the third lecture following on from our inaugural lecture, which was given by Professor Kamara Jones, the second by Professor Sir Chris Whitty. And this morning, I'm delighted that we're joined by a fantastic group of colleagues who will be reflecting on climate change and public health, where we are now and where we're likely to be going in the future for programs, for policy, and for advocacy. Now, I'll have a chance to introduce our panel members as well as our speakers a little bit later on, but I wanted to begin by welcoming you all to this distinguished lecture today. Now, as many of you are aware, the Faculty of Public Health has recognized climate change as the greatest threat to human health that we currently face. And we have had, over the past decade, a very proactive program of work led by our subcommittee and special interest group aimed at raising awareness about the issues related to climate change and health, advocating for greater public health awareness, policy and action, and ensuring that issues related to climate justice, evidence-informed practice and policy are at the center of our work in the faculty. Climate change, COP, can be seen as crowded spaces, but we feel that the faculty can and has been able to articulate and to carve a unique space and place within the climate change and climate crisis space. And we know that the work that we've done in support of COP, both in the past and in the future, will be a key part of this work. Now, for all global problems, we will need global solutions. And I believe firmly that public health practitioners, whether here in the United Kingdom or around the world, are going to be really well placed to be part of those solutions. With that, we are looking forward to the time that we have together this morning. We want this to be as interactive as possible. So I'm going to ask you to both participate in using the chat function. If you'd like to ask questions, please put them in the Q&A function or in the chat function. We'll be monitoring them as we go through the presentation this morning. And of course, we'll have a chance, if you're willing to ask any of our panel members or respondents questions, you'll be able to do so as well. Finally, just to give you a sense of the flow of the morning today, we'll begin first by hearing from our keynote speaker, Maria Neira from the WHO, and Dr. Neira will give her initial address. We'll have a chance for a question and answer based on her presentation. Following on from hearing from Dr. Neira, we're going to welcome a panel of public health experts from across the UK who will be reflecting on what they've heard from Dr. Neira, but also reflecting on what more needs to be done in the United Kingdom. And I'll be introducing the panel members as we go through the morning. So with that, and with no further ado, it gives me great pleasure to introduce our distinguished lecturer, Dr. Maria Neira. Now, Dr. Neira is the director of the Department of Environment, Climate Change and Health at the World Health Organization. And prior to that, she served as the Undersecretary for Health and President of the Spanish Food Agency. Dr. Neira began her career as a medical coordinator working for Médecins Sans Frontières, Doctors Without Borders. She then spent several years working in different African countries during armed conflicts. Dr. Neira is a medical doctor by training, specialized in endocrinology and metabolic diseases in Paris, France, a master's in public health, and a university diploma in human nutrition, epidemic preparedness, and crisis management. We're so pleased to welcome Maria here to join us to our Faculty of Public Health family and are excited to hear about what you have to say this morning. Maria, over to you and welcome.
Thank you. Thank you very much, Professor and Dr. Fenton, dear Kevin. Thank you very much to all for giving me this amazing opportunity and responsibility. Somebody told me, Maria, you have to inspire people, and this is the most difficult thing that people can ask you to do, but I will do my best, not to inspire, but at least to share with you the passion that we have been, many of us, bringing into this debate and dialogue and agenda of climate change and health. Kevin, you mentioned that we need to tell you where we are. And it gives me a lot of pleasure to tell you that we are in Baku. I am at the moment in Baku in Azerbaijan, because as everybody knows, this is the place where COP29 will take place in a few months from now. Azerbaijan took the responsibility to host the COP29 in November 2024, COP29. So we are here to start to make sure that the health authorities, the foreign affairs, the presidency of COP, and of course, Ministry of Environment and many others, we are here to make sure that they understand that the health argument is the winner. The health argument is the one that can change completely the speed at which we will obtain results on climate change, on fighting climate change, and the one that will be creating more ambition, more decision to do things, or at least this is what the health community think, and we are all convinced about it. We are convinced that health can be the engine. It can be the ultimate reason for accelerating action on climate change and health. And there are many reasons for that maybe together we can go through and making sure that we are all perfectly strategically aligned, because the work is enormous to do. Just to tell you that it's interesting to see that Baku, I never been here before, so Baku, the capital of Azerbaijan, is an interesting mixture of buildings which are very much Soviet style, and now a lot of modern architecture. And this reminds me what public health is about. I think in the past that somebody asked me, what do you think about public health? And for me, the public health is a kind of very sophisticated cuisine where you need to make sure that you mix the ingredients on the most successful and impactful way. And public health is this balance between science, policy recommendation, where you can put your influence, where you can put your knowledge in order to create better conditions for people to generate a healthier environment and obtain better results. So I always keep in mind that public health is an art, the art of mixing things and making sure that you always have the best ingredients. Sometimes your ingredients are very good. You have a lot of scientific evidence. You have an incredible amount of demonstration that the science is right, and still things are not happening. Other times you have very little science, but there is a lot of international attention, or citizens are very concerned, and then things happen. So how we mixture, how we play with all of that, and as a specialist, as health professionals, are those who are passionate about the public health. How can we play with all of those elements and obtain, which is the most important thing, the most impactful interventions for protecting our citizens, our global population's health. And when we talk about climate change and health, Kevin mentioning that I hope I can be informal and call you Kevin. You know, I'm Spanish, so I tend to be a little bit informal sometimes. But as mentioning at the beginning, thank you, Kevin. I take this as a yes. When we started to talk about climate change and health in WHO, which was many years ago, don't think that this started now. There are documents in WHO talking about our health, our environment, climate change, and our health that are decades ago, and science is already there. But what we have realized with this expression, with this statement on the climate change can be one of the greatest challenges for global public health. Very soon, we put it together with another sentence, which was climate change is one of the greatest challenges for public health, but it can be as well the greatest public health opportunity. And let me share with you why. Maybe you are already very much convinced, but if you look at the Paris Treaty, and I'm sure that you are very familiar with the Paris Treaty, go one by one on all the recommendations and agreements of the Paris Treaty, and all of them are nothing else than basic public health interventions. Because in fact, if you want to tackle the causes of climate change, you need to ensure three transitions. The transition to sustainable, renewable, green, clean sources of energy. And this is fundamental for our health. I mean, promoting access to clean sources of energy is nothing else than contributing to the reduction of these 7 million premature deaths that we have every single year. 7 million premature deaths every year caused by exposure to air pollution. And the causes of air pollution, most of them are related to the fact that we are still combusting these fossil fuels that are so damaging for our health. So clearly, all of those interventions on accelerating the transition, the transition in a way from fossil fuels is a beautiful public health intervention that we all need to push for it, because our health is very much depending on whether or not the governments, the countries are successful on doing this transition to clean sources of energy. The quickest we do it, the more we will reduce in the deaths and the suffering and the diseases and the cost for the health system. Because this is an element that normally in public health, we feel very uncomfortable to talk about how much it takes, how much it costs to treat our patients, and we don't want even to compare that. But if you look at the money we are spending now in our governments are spending on health, on treating those chronic diseases that will require a long time treatment. And you take that cost and you invest it on the prevention by simply accelerating this transition to cleaner sources of energy. The benefit for the health system, the cost that we are putting on the health system will be so positive. Only by stopping giving fossil fuels subsidies, we will be able to match all the cost that they represent now, almost the entire universal health coverage. So it's amazing that we are financing, we are subsidizing fossil fuels, which are the ones then killing us. I don't want to compare it, but at one point, I think I said something like, air pollution is the new tobacco, because somehow we are subsidizing, we are consuming, we are inhaling polluted air, toxic air, which is then killing us, and we are giving subsidies to this polluted air to be maintained and to keep sending us to the hospitals and keeping our health very much at risk. But let me go back to the three transitions. One that was this transition to sustainable, clean, green, non-polluted sources of energy, where the public health community has to go really enforce. The second transition, and I'm sure I don't need to convince you, is the one to the sustainable food systems. And that's good for tackling the causes of climate change, and is good for health. Imagine that if we promoted healthier diets, the number of deaths we could reduce in terms of malnutrition and overnutrition. It will be really incredible. So we have the same agenda, climate change and nutrition, in this case, on promoting a sustainable food system. And the third transition, which is very important, is the one that is already happening in our cities, in our urban environments, the places where we live. And in 20 years, more than 70% of us, we will be living in cities. So the public health community cannot just sit there and watch what is happening at the urban level. We need to engage with architects, with urban planners, of course, with mayors, with local authorities, and we need to make sure that they hear us. They hear us when we say, you need to reduce traffic in those streets because that traffic is responsible for the bad air that we are breathing, or the fact that our citizens cannot walk, and therefore sedentary lifestyle and obesity and metabolic syndrome are facilitated by those conditions. They need to hear us when we say our buildings, that the places where people live, we can have a more energy efficient system. We can do our cooling and our heating on a more effective way. And sometimes they might look at you and say, what are you doing this? I mean, this is not your business. Leave it to us. Leave it to people, engineers or architects or others. No, this is our business very, very much. This healthy urban planning can condition on an incredible way the health of our people, the health of our citizens. And because of that, we need to be very much part of this conversation and influencing those policies very, very much. And they need to get used to us on a very strong way. So those three transitions are the ones that are very much at the game at the moment. So where are we on the COPs? Let me tell you a secret. When we started to go to the COPs with one or two of my colleagues years ago, I remember going around and trying to talk to the president of the COP or people high level who were there, trying to influence them. And we were going there and saying, hello, we are from the World Health Organization. And then they were looking at me saying, who? And I say, yes, who? Exactly that. Yes, who? WHO. He said, okay, who? Yeah. Oh, thank you, dear. And it was everybody was nice with us, but totally kind of ignoring us. They didn't see the connection between climate change and health. Then we started to produce the evidence, obviously with your help. I mean, all the schools of public health, all the scientific academic community, everybody around joining on this scientific evidence. But then we did something else. We started to link the climate change agenda not only to future of the planet or future generation or even glaciers or polar bears. We started to talk health language. We started to say, okay, look at asthma cases and air pollution. And that was very, because people make certain time to understand the connection between climate change and health, but they see very quickly the connection between air pollution and asthma cases, for instance, or even cancer, lung cancer or other respiratory diseases, maybe not with cognitive developments or things like that, but they see the connection when you cannot breathe, when your eyes are feeling that there is a toxic air, when you go to, let me use several examples, Shanghai, Beijing, Mexico City, New Delhi, and others, you spend a few hours, and after a few hours, you have even a horrible taste in your mouth because you are inhaling and almost eating the pollution that is in there, and then people see it. So we started to use the health argument and saying how many people will be affected. But then we decided something else. We need to communicate in positive. And this is for all the health, the public health community. We need to communicate positive and of course real. Doesn't mean that we don't need to present the scenario, which is quite apocalyptic, which is quite dramatic. And of course, the magnitude of the impact of climate change on our health is terrible. It simply touched the pillars of our life: food, water, and shelter, and the quality of the air we breathe. So it touches everything, and it will displace us if we have extreme weather events. It'll create horrible conditions of heat waves if we live in cities and we don't have access to air conditioning. It will be increasing the possibility for mosquitoes to create their families and reproduce on a more pleasant way. And therefore having diseases, an increase on the prevalence of certain diseases. So mental health, I don't need to give you all of those negative impacts that climate change is having in our health. But while we say all of that, we need to as well use the positive arguments. And the positive arguments say are, okay, if you accelerate transition to clean sources of energy, look at the number of deaths you can save. Look at how you will reduce the prevalence of certain diseases, respiratory diseases in your community. Look at how much you will reduce the admittance at the hospital for certain diseases, and look at how you can improve the intelligence of your community by protecting the IQ and the cognitive development, and even many, many more. So if we start to communicate like that, if we tell the negotiators of the COP, which is what we did last year very strongly, saying, when you are negotiating, I mean, when the member states at the COP are negotiating the level of emissions, the proportion of emissions, don't think that you are just proposing a figure and saying, well, we need to keep 1.5 Celsius degrees in increase on the temperatures. Anytime you are negotiating with our lives as well. Because if you decide and you agree to reduce emissions in 20 years from now, okay, you need to be prepared to assume that you are responsible. You as a politician, as a negotiator, you are telling us how many cases of lung cancer we are going to have, how many increases in the asthma cases we are going to have. Are you prepared for that? The other way around, if you are very ambitious and you accelerate your transition away from fossil fuels, instead of in 20 years, in 10, look at the numbers of lives you can save. Let me check the watch. It's okay. So that's the messages we are giving now, communicating in positive, or at least on a way that no politician can say, I didn't know that this was about health. I didn't know that with my decision, I could reduce, all of this number of deaths that we have every year. So this is where we need to be very strong, very influential, because the voice of the public health is still very credible. We still have certain credibility, and a strong credibility, I want to think. And that's why that credibility was the one that last year at Dubai, for the first time ever, we have this health day. And this health day was not just to bring in the ministers of health to the COP, where they felt a little bit out of their comfort area, because, the COP is for negotiators, is for people working on energy, on environment, on presidency, on business, on everything. But the health ministers, they were feeling a little bit out of their place. Now they understand that they have a huge role to play, and their voice was absolutely fundamental on I want to think that the fact that we have this health day last year, and trust me, it was not just a one question that somebody had the idea and then we have the health day. It took us more than 10 years of negotiation, pushing, influencing, convincing, mobilizing the health community. We made it last year. It was fantastic to have thousands of health professionals represented there, making a lot of noise, the good noise, having all of these ministers, having almost 150 countries signing a declaration on climate change and health. I know that is not legally binding, but it's still very strong and influential, because then the ministers, by reading that declaration, by discussing that declaration, I think they saw more than ever the role that the health community can play in all of that. Let me go back to this history of the COPs. Last year, we obtained something quite extraordinary. And of course, we don't want to go back. We want to, at the contrary, here in Baku in November, we want much more than that. This is the message we passed yesterday to the Minister of Health and Minister of Environment and the presidency of COP. We want much more. We want things that we are negotiating now with them, and we want to make sure that the health community will be fully supporting this movement. So I count on all of you. And actually, there will be a consultation on how the health community needs to be engaged. And I really hope that your public health school and all the participants will join us on that, because we need you. We need pediatricians. because normally pediatricians and respiratory specialists, they will be at the hospital taking care of the patients, but we need their voice to influence and tell them, I don't want to keep treating an asthma patient if then, after the treatment, I need to send that patient back to a very polluted street, where again, this patient will be exposed to very high levels of pollution. So this COP29 has to be the health COP. And we have to be very strong because, as you can see, this is COP29, which means that for 29 years, the world has been negotiating an environmental treaty. Can you believe it? Imagine that it was a public health treaty and WHO and partners would say, well, we need another 27 years to negotiate. This is absolutely unacceptable. Or if you are at the emergency room at the hospital on Saturday evening and a patient comes in and you say, well, I need a couple of days to take a decision whether this an accident and this patient needs surgery or not. Give me a couple of days to think. No way. So for health reasons, we can't afford to have 29 years of negotiation. So once the health argument is there, and I need your voice, your support, your engagement, your leading by example as well, because we need to reduce the footprint of our health systems. Lead by example. Any of you is an activist, any of you is a scientist, any of you can influence, whether it's a small influence or a big one, everything counts. We need to make sure that at the COP, this health argument is the winner. We need to make sure that as they did in Dubai, that ironically, because it's a an oil producing country and everybody was criticizing that, but ironically, for the first time ever in Dubai, we have on the test that is transitioning away from fossil fuels. And I want to think that that was the influence of the health community. So we reached there. Now we need to go for much more. My dream will be, and the dream of my team will be, that soon we will have an indicator, a health indicator on the treaty of climate change, and saying, okay, not only the reduction of the greenhouse gases emissions or the level of temperature, but saying how many lives you have saved by taking this action on tackling the causes of climate change. And we can prove it, for instance, using the indicator of the levels of air pollution according to WHO standards on air quality. Why not? Or maybe others that we can put together forward. I think I need to start to wrap up, but few things. I mean, go beyond, go beyond. It's not just doing science. We need to use that science. Science is gold, but it's gold only if we can use it, if we can transform it on recommendations or influencing. Somebody told me one day, I think it was a minister of environment, he told me, Maria, there is no glory on prevention. And it is true, there is no glory on prevention. There is more glory on sending tons of pills to treat one disease, or impregnated pet nets, or sending something material, or doing a big vaccination campaign. But we need to make sure that we will have glory on tackling the causes of climate change and counting, monitoring, quantifying the benefits for our health by doing so. So our role is much more than doing science. It's influencing any moment, any opportunity. The mayor of your city, the people living in your building, you when you take your bicycle and then convincing other people to do the same. On recycling, we need to lead by example. We need to be the ones that will be driving, leading this common sense movement for a healthier world where we tackle the causes of air pollution. And by doing so, we are not doing anything else than promoting a better environment, a healthier environment, and a place where our health can be very much protected. Let me see. What else? Again, don't allow anyone to tell you this is not your business, because that will be a temptation at certain environments. Say, well, okay, this is a technological, this is something that engineers will solve. No, make sure, and this is my last recommendation. Do you speak NDCs? We need to learn that language. NDCs, not NCDs, NDCs, National Determined Contributions. Every country now around the world is doing their national determined contribution, how they are responding to the Paris Treaty and looking at how having a national plan to tackle climate change. Make sure that you are aware of that plan. Make sure that you push for having the opportunity to be part of that, because health is used at the national determined contribution as an argument at the beginning to kind of mobilize more action, but the health representatives are never seated at the table when and where this national determined contribution is decided. So have a look at that. Look at the benefits that can be obtained if your country implement the national determined contribution, and then make sure that you influence and you speak currently the NDC's language, because we need very much to be at that table, and you need to pass it to your students or to your colleagues, to your peers. You need to make sure that we put our nose into that NDC's development. I hope I will see you all, not all, but a representation of you at the COP here in Baku. I hope I will see you before, and I hope that you will be join us this strong movement of the health argument for more climate action, and by doing so, perpetuating as well the good legacy from ATTACH, which was created at the COP 26 in Glasgow, which was a health commitment, very, very nice on climate resilient and sustainable health systems, and decarbonizing our own health system. So decarbonizing the health system, but not decarbonizing our brain, that has to function very, very well, because we have a huge task in front of us, and I'm afraid that this has to be led only by the health community. I don't see anybody else doing it. Thank you very much for your attention.
Wow, Maria, thank you so much. That was such a wonderful and inspiring canter through the history of the climate and health movement, really articulating some clear priorities for your work now. But I really also loved the final 5 minutes where you really set the charge for what we need to do. Go beyond science, lead by example. Don't allow anyone to say that we shouldn't be in the room. And of course, the NDCs, which I think, and I'm sure you will have lots of questions on as well. How do we become involved in that? And how do we ensure that health and public health becomes part of that? So Maria, I have the pleasure of just having 20 minutes with you to ask you questions. And, you know, with our distinguished lectures, we always begin with the person, and then we go to the issue as well, because you've had this amazing career. And I think one of the first questions I wondered if you could reflect as a leader in public health about what was your journey to getting to where you are today, leading this climate and health program in the WHO, and what leadership lessons have you learned along the way? We have lots of colleagues from all over the world on the call at different places in their leadership career. What are some of your keys to success for public health leadership?
Thank you, Kevin, and I'm happy to hear that it was not too boring, at least. I mean, for me, WHO, when I was a medical student, for me, WHO was a place with wise people with very long beards, you know, where all the wise of the world was keeping. So I never even thought of being working in WHO. For me, it was the Bible, but nothing else. I mean, it was something very remote. I always wanted to be a medical doctor, that yes. And then I've been very lucky and privileged to do endocrinology, which was what I wanted to specialize on it because of the feedback. You know, I love the feedback. All of this in endocrinology, this famous feedback is something that gives you this holistic view, the context, you take distance and you analyze. It's not just of repairing one thing. You need to be conscious of the consequences, and therefore you need to have this holistic view, and that has been extremely useful for me in public health. If you look at a very small piece and you lose the perspective, you are not good on public health, I think. So what's happened is that I did endocrinology in Paris. I was fascinated about the possibility to stay working on a hospital very specialized and very sophisticated in Paris, doing diabetes and thyroid and things like that, very happy. And then one day I went to a meeting with Médecins Sans Frontières in Paris, and I got absolutely fascinated. I said, yeah, I need to do this at least for 6 months, and then I go back to my hospital. I did it for 6 months in a refugee camp in the border between Honduras and El Salvador. Then I renewed for another 6 months in the border with Nicaragua. Then I realized that public health was not about treating patients and keeping those patients coming every day to my consultation. Well, consultation, call it. It was a very precarious place, but I say, no, something is happening with this asthma boy. I need to go to see where he lives. And he was living on this very precarious shelter. And of course, they were cooking inside, no way to have ventilation. So I fight it with the guys from the UNHCR saying, no, we need a common place for people to cook and maybe on an open space. We need to, and I started to learn about public health in a very intuitive way. And then I went to Geneva for other reasons, and then I started to work in WHO, which is, I feel so privileged since then. So I'm a lucky privilege, and by coincidence, things happen, but my passion has guided me where I am, I suppose.
Yeah, and that's such an important part of the journey in public health. Many of us start this by thinking, how do we change the world? How do we make things better, not just for one individual, but for families, for communities, and for society? And that's, I think, the passion that we bring, and that passion certainly came out today. So we have a few questions specifically now on climate. I'm going to start off with one that I think the faculty is really concerned about, which is inequalities and justice and the climate agenda. And the same populations who are disproportionately affected by health inequalities are likely to be the ones for whom climate justice is also going to be an issue as well. How do you integrate this into your thinking and your advocacy around climate and health in WHO?
Yeah, we are very much almost obsessional about this issue of inequities and inequalities. It's absolutely an insult for for the society. I think when you look at Africa not contributing or contributing 4% of the the greenhouse emissions, and then a big proportion of the number of countries which are the most vulnerable are in Africa. So you start to look at all of these things, how we react. Well, first, there are certain decisions at the global level that they need to be taken in a very strong way, and those will be protecting the most vulnerable and everyone, but certainly the most vulnerable. For instance, this quick transition to fossil fuels is very important. This is a global and maybe very general, but those who will be very much benefited are the vulnerable people. And this is when we need to talk with governments in vulnerable countries and help them to do this transition, because for the time being, in Africa, you have plenty of solar energy. Do you see enough on our healthcare facilities in Africa? Most of them, they don't have reliable sources of energy. Can somebody explain me why we cannot have a solar panel in each single healthcare facility? We are still sending diesel to Yemen. And that diesel cost, the transport of the diesel cost maybe more than what it will cost to bring a fantastic renewable energy full hospital. So we need to help those countries to transition, to understand the economic argument, and of course, presenting all of those cases, negotiating with the countries that can be the most beneficial. This is our kind of everyday mantra, and where we need to obtain better results every day. Yes.
Great. Although we've had a number of questions on the COP process itself, I think colleagues are sometimes increasingly concerned about what's sometimes perceived as the takeover of the COP by the fossil fuel industry, and whether you see that this is the future of the COP process, or do you see us being able to manage it? Could you reflect a little bit on that? I think for many public health practitioners around the world, we were looking at, certainly in Dubai, fossil fuel industry involvement and leadership, and that's likely to continue in the short term. What are your thoughts on this? How does WHO navigate this? And what might we do to ensure that there are clear advocacy and strong advocacy on what was one of your pillars, which was sustainable clean energy?
I think in terms of, if we start with your question on that, what is WHO doing? I think you all saw the very strong and non-ambiguous statements by WHO saying, phase out fossil fuels. I mean, we are not naive. We know very well that phasing out fossil fuels will take a transition. We need to go through this transition. It will not be an equal transition for all the countries, but certainly we know very well that this transition can be accelerated and can be maybe even better influenced in Africa and other countries, as I was saying, because the moment we are talking, there are certain groups that are influencing African countries saying you need to go for fossil fuels, while they could perfectly be the leaders on other sources of energy. But because of the governments, maybe, or the heads of the governments, there have some conflict of commercial interest, they might look for the easy solution while it's affecting their country. So WHO is not ambiguous at all on saying phase out fossil fuels. Now, regarding the presence of the private sector at the COPs, this is not, I mean, the private sector will be present no matter what, whether they are in the COP physically and visible or behind, they will be there for sure. So maybe it's better to have them physically there and seeing and all of that. The best way to win on that battle is not by eliminating the private sector that is still there and they have an incredible power and lobbying and money and everything, name it, is maybe by going to our citizens and telling them fossil fuels are killing you. Do you realize that? Fossil fuels are sending you to the hospital. You are already paying the price. So put pressure on your governments to go for other sources of energy, which are more protective of your health. So the moment there is a demand, I think this is the best way. Fighting with the private industry, us as public health officers, they are going to win. I mean, that for sure. But if we use our arguments and we put it on the face of the politicians, if we put it on the understanding of the citizens that vote and they elected the politicians, and if we use on a very powerful way the health argument, I think this is where this transition will be irreversible and unstoppable.
And I think what I'm hearing you speak to, Maria, is a pragmatism that we need to have as public health practitioners as well. Yes, being focused on the goal that we want to achieve, but recognize that actually we may need to work with different partners in different ways to achieve it. And also recognizing some of the imperatives that countries face, right? Because they are going to want the private industry involved for job creation. The fossil fuel industry will be involved in some shape or form. So how best to create those partnerships to move this agenda forward. The next question builds on this and talks about what we see from the outside, that countries are moving at different pace in terms of their net zero commitments. And in fact, we see some countries even reneging, going back on their net zero commitments, either pushing the dates forward or saying that, they're going to be less ambitious. How does the WHO and certainly your work on climate and health, what do you think are some of the issues there in terms of why countries may be rolling back from their commitments? And is it evidence and advocacy that can help them to get back on track?
Again, I think as a public health community, we have the right strategy. But we need to look at the tactics now under the strategy. I don't like to use the military language, but the strategy is good, but now we need to use our tactics very, very smart. And again, I think the best way to do that is to use our health arguments and talk about those diseases. That's why we need the voice of the public health community, using very pragmatic arguments, very concrete arguments that will talk to our citizens, and as well, and this is part of the tactic. Sometimes we are accused of being naive. Oh, you guys, you are very nice. You are proposing very nice things, but you don't know what you are talking about in terms of the economic consequences of this, or how this will be affecting jobs. We all know that we need a just transition. We all know that we don't want to, when in a country you say, okay, tomorrow the price of the gasoline will be this one, and that might create a problem for the poor people. So those are the ones that, so we need to democratize as well the issue of climate change. We cannot, and this is something that, thanks for giving me this opportunity. Sometimes on our tactics, we might end up creating a kind of elite of climate change and health. When I say elite, is creating these people who are convinced, and therefore they have an electric car, they are vegetarian, they recycle it perfectly, they travel differently, and you have a car that is perfect for that. But to do that, you need money. So we don't want to create an elite that give lessons to the poor population that lives outside of Paris. They need to commute every day. They have a very old car, very pollutant car, but they don't have the money to change it. So we need to make sure that the government take important decisions to subsidize this car that these poor people cannot afford, to subsidize better systems for heating and cooling for poor people, to stop subsidizing fossil fuels and investing in something else. So we need to take care of this population, which is not necessarily the elite one that can afford to be vegetarian. Even vegetarian in our cities is very expensive because processed food is the cheapest one. So we need to be very strategic and very tactical on what we propose to the government, and never give the impression that we don't have a proper plan, that we are naive and say, oh, you have to remove this pesticide. Oh, you don't know what you are talking about. Yes, we do know what we are talking about.
Yeah. And Maria, the final question, I think right at the beginning of the talk, you really touched a lot of colleagues listening to you, because you went straight to what we do as public health practitioners to create healthy places. And you linked the greening of our cities, the sustainability of our cities, and the urban environment is one of your key pillars. So I think a question that just the final one for you to reflect on really is any additional reflections on that journey to create greener cities, that agenda, and in an environment where misinformation and myths, especially about, for example, the 15-minute cities, can come up, the effectiveness of air pollution interventions, for example, in London with ULEZ, as you know, there's always that misinformation and myths about some of these issues. I wondered if you had any reflections on, yes, going green, but also managing the messaging and taking people with us.
I will go back to my training as an endocrinologist, and again, pushing for this holistic approach. And when you promote a measure, you need to be aware as well of the whole package that you are. So London is a champion. We are so happy with ULEZ and all of that. Again, there are many considerations. So you as a public health officers, be conscious of the messages and the communication, and make sure that you have the science, but as well some solutions. And promoting public transport is fantastic. If you don't have a good public transport, you have a problem. I mean, you can put many measures that. So again, the communication is very, very important, and it's very important on pandemics. It's very important on every issue. So you can have all the science on one thing. If you don't have this perspective and a holistic approach, you might end up giving arguments to the negative people who will try to destroy your argument. So tactics and communication is something that we need to learn so much on public health.
Yeah, I couldn't agree with you more. And I think colleagues who know my own practice know how much I put on communication, both the individual communication to policymakers and to other scientists, and the public communication as well, and deconstructing and inspiring people to be part of this movement for healthy, I think, is a key responsibility for all of us in public health. Maria, you've been wonderful, and I'm going to give you a chance now to take a breath. Thank you for the amazing lecture and the reflections as well on leadership, what needs to be done, and some of the intricacies of getting this work done at the global level. We're going to bring it now to the UK, and we're going to look at place, and we're going to hear different perspectives from colleagues. And we have 4 fantastic panel members who I'll be introducing each, and I'll be asking them to speak for 3 or so minutes, reflecting on what they've heard from Maria and what it means to their practice. And then following the interventions from each of our respondents, we'll bring Maria back and we'll end with a final panel discussion. And again, all of your questions coming into the chat, we'll have a chance to reflect on them. So our first reflection then is from Deborah Harkins. Deborah is the Director of Public Health in Calderdale Council, and she's been the DPH there since April 2020, and she's responsible for climate action. Deborah, welcome. What are your thoughts on what you've heard this morning, and what does it mean for your practice as a DPH?
Brilliant, thank you, and thanks, Maria. Your presentation was incredibly inspiring, but it was also really wonderful to hear your career story as well. And as Kevin says, part of my role as Director of Public Health is to be the lead director for climate action. So Calderdale Council has really recognised the fundamental links between climate action and health. And I was new to climate action when I joined Calderdale Council 4 years ago, and I've learned an enormous amount from my colleagues. And I hope I've been able to bring some public health skills and approaches to our climate action. Climate change really matters in Calderdale. It's one of our 3 organisational priorities, and the impacts of global warming and the need to be resilient to climate change are real for our local communities right now. It's a place of steep-sided valleys, and some of our towns and neighbourhoods have experienced flooding, really significant flooding 3 times in the last 10 years. So listening to Maria's presentation and thinking about this, what this means for my practice for local action on climate and health now and in the future, I've got 3 reflections. Firstly, collaboration. Maria's really demonstrated the importance of international collaboration to make an impact, and this really got to be mirrored at a local level. So in Calderdale, we've developed our collaborative approach to tackle global warming over the last 4 years, moving from really what was largely sort of a local authority focused approach to a genuinely multi-agency climate action partnership. And the partnership's made up of really passionate leaders from right across the statutory, business and voluntary and community sectors. And we've developed a climate action plan that's been really informed by the science. We developed a Calderdale specific emissions reduction pathway, which really set out the science of the pathway for us to get to net zero. And we're taking a system approach. And again, I really felt that in what Maria was saying in her presentation. So the system approach we're taking includes working together to support and enable community climate action, creating warm and resilient buildings, growing a green economy. We've just been talking about transport, haven't we? Transforming the transport and how we get around, working on land and nature. We've also declared an ecological emergency. And then really working, this really resonated from what Maria was saying, really working together to influence beyond Calderdale. So our partnership has developed an influencing strategy, and we've worked with our regional climate commission to really embed climate adaptation, building up from a public health service climate adaptation plan. My second point is the essential contribution of communities and civil society. And again, this is something Maria talked about. We've got in Calderdale a really long-standing, rich, talented climate action related voluntary and community sector. It includes campaigners and advocates for climate action, as well as organisations and groups that are really making climate action happen. can't list them all, but there's lots and lots. For example, the incredible edible sustainable food movement started in Calderdale. We have really innovative voluntary organisation working on natural flood management. So the role and the contribution that those groups make is absolutely pivotal. But building on the last bit of the questions with Kevin, I think in these times when information and misinformation are so easily confused, the role of trusted voluntary and community groups to listen to communities, to talk about and to support climate action is absolutely critical, those trusted voices. And then finally, and I really think this was really powerful from Maria, being hopeful about a low carbon and resilient future. It's so important, isn't it, to have hope and be optimistic about our ability to take climate action. And I think too much of the framing of climate action focuses on the need for individuals to make sacrifices. And it's likely probably that's been influenced by fossil fuel industry in similar ways as we've seen with tobacco industry, as Maria said. Instead, Calderdale's Climate Action Plan tries to set out a vision of what a low carbon and climate resilient Calderdale will look like, will feel like, really demonstrating how wonderful it'll be. And we've also included really inspiring examples of local action in our plan, showing each other what's possible. So to finish, ultimately taking climate action to reduce greenhouse gases and be resilient to global warming will be really, really good for people's health. That's a good news story that we can all be proud to tell.
Deb, thank you so much. A great way of bringing what we've heard this morning right to the local level, right to the sort of pragmatic and practical things that need to be done. And I loved your last point about being hopeful around this. I think part of what we do as public health people is not just the evidence and programs and policies, but to give hope to the populations that we're serving, that a better future and a better health outcomes are possible. So thank you. I'm sure we're going to build on this with our next panelist, who's Professor Mala Rao. Now, Mala is the director of the Ethnicity and Health Unit at the Imperial College London. She's the chair of the expert group on climate change and health, WHO Southeast Asia region, and vice chair of WaterAid UK. Mala, we're so pleased to have you with us. We're keen to hear your reflections.
Kevin, first of all, can I begin by thanking you? What a privilege to be invited to respond to Maria's lecture. And I'd like to begin by saying a big thank you to you and also a big thank you to Maria for an uplifting talk, which has certainly reaffirmed my belief of, well, something like 3 decades that we in public health must continue to lead the process of embedding health into climate strategies and action. Maria made it absolutely clear, we all, I believe, understand it, that the urgent need to step up action on climate and health is absolutely core and is not in question. However, hearing all that I did and reflecting as I have done for the past 6 months or so, I wonder whether I might propose a corollary to that core message, and that is to do with gender equality and raising the voice of women and ensuring that they too can fully contribute to and benefit from climate and health action. Because whether we consider women living in developing or developed countries, they bear the brunt of the health impacts of the climate crisis, because of course women form the majority of the world's poor, and it is those with the least resources who will be most susceptible to its negative effects. And I know all of you will agree, Maria especially, because she sees the picture from around the world, that from water scarcity to food insecurity, it's women who are disproportionately affected. And I see that at WHO Southeast Asia region, where the expert committee hears and sees case studies, and hears the evidence about women facing these appalling challenges, from high mortality in climate disasters, subsistence farmers facing devastating crop failures, or deprivation of every kind when they migrate. And 80% of climate migrants are made up of women. But, you know, the key point of my message is women are not passive victims. They are the most powerful catalyst for change. And we need to utilize their perspectives as the primary caregivers in the home, the managers of household energy and water, stewards of natural resources, more inclined to participatory networks, whether it's in London or in Dhaka. And the evidence pointing to the fact that even in the developed world, women are intuitively more inclined to sustainable choices and adopting healthier lifestyles in the interests of their families' health, if it's made, as Maria rightly pointed out, if it's made affordable and easy for them to make those choices. Because it's our ethnic minority poor women who are most worried about the risk of air pollution as they live in London's transport corridors, and their children face this on a daily basis. In the world of climate science policy and leadership too, there's an underrepresentation of women, as COP28 statistics demonstrated. I see that at Imperial in the climate science department. So please, we recognize that climate and gender justice go hand in hand. And we ask for women, depending on the specific context, to have greater access to decision-making, financial systems, information, not fake information, as you rightly pointed out, Kevin, but the right information from us public health people, to everything from reproductive choices to how to achieve that win-win for family and climate through supporting strategies for healthy cities or healthy lifestyle choices for the family. So, you know, I'm going to end there by saying, Maria, thank you so much for getting health into the core of climate strategies and inspiring us all with your leadership. You know, COP28 was a health COP. Could I be a little bit more ambitious and provocative and say, please, Maria, and you, Kevin, and all of us, can we make COP29 a health and a women's COP, please? Thank you.
Challenge accepted, Marla, and I look forward to hearing Maria's view on that. Thank you. Again, shining the light on the justice issues and how they underpin the work on both health inequalities and, of course, climate justice, but also specifically shining the light on the role of women as well. I'm going to now move to Professor Paul Johnstone, and I'm delighted Paul is with us today. He's the chair of the Faculty of Public Health, Climate and Health Committee. Paul is a dear colleague. He's an independent public health consultant and a former regional director of public health for the north of England and Yorkshire. Paul, welcome. Looking forward to hearing your reflections.
Yeah, thank you very much, Kevin. And Maria, thank you very much. What I'm going to do is just a couple of reflections, but I thought I'd also just give a little bit of background to the work we're doing in the faculty and the work of our strategy. But before I do, I just want to say, Maria, thank you very much for your leadership in this space. And congratulations. I thought COP28 and the Health Day and the Health Declaration moved us far further forward than I thought we would. And so many congratulations for your role in that. We were there, you know, we were there virtually, and we were playing our part, our small part in what was a great COP. And we look forward to taking part in COP 2029. So a quick couple of reflections. You started out by saying that the health argument is the winning argument, and clearly I couldn't agree more. And it made me reflect on work that we did 20 years ago when we were very exercised about the tobacco and smoking levels and wanted to bring in legislation on banning smoking in public spaces and bars and restaurants and pubs. And we were losing the argument to start with. We were losing it against arguments on freedom and rights and so on. And it wasn't until we clinched the health argument and also that innocent lives were lost through passive smoking, that suddenly public perception changed, and with it politicians' perceptions changed, and we got the legislation through Parliament. And I think from those days, I think a lot of learning about working with industry and the tobacco industry, and I'd very much like to see that learning played out as we grapple with climate change and the role of the fossil fuel industry as well, which you raised and talked about just now. My second point is about communicating positively. Again, when we did the smoking legislation, positive communication was really important. In this, this is about co-benefits, and in particularly this year in this country, which is election year, I think there is something really important about communicating the messages to our communities and the community engagement, again, which you alluded to. If our politicians who go from door to door and perhaps once, in 5 years actually listen to what people are saying, if they hear messages about wanting to, about needing to tackle the fossil fuel industry and climate change at the doorstep, I think that would have a big impact on the way that that manifestos and then future governments will behave. I've got a question about the WHA role, the World Health Assembly role. I think this is an incredibly important year for the WHO, and I'd be interested to know what plans and how we can help with the World Health Assembly to make sure that we seal those declarations and agreements from COP28, particularly around the funding and tightening up the health declaration as well. So I'd be quite interested in your reflections on that, but also how we can help as well. So there's some quick reflections, but just to update you and also colleagues on the phone here is what have we been doing in the faculty? And so our approach is, obviously we are the UK's main professional body for public health practitioners. We've got over 5,000 members, and we have a strategy for climate and health, which we revised and upgraded earlier last year. In the process of doing that, we did a listening exercise and a consultation exercise, so we were able to embed in what is going on locally. Deborah gave some great examples of what's happening in Calderdale. And it's patchy though across the country, and most of our colleagues are busy and they see this as a future problem and have to prioritize against a number of other perhaps more pressing issues. However, one of the messages came out, there was a need to build up evidence still and to build up confidence to address the issues locally, regionally, and nationally. Also need in handling the politics of this, which can be very tricky, as Kevin will know from London and the EULAs. This is an incredibly political area, and more help and resources to support that is definitely needed. So with that in mind, we have a strategy. We are covering 3 things in that strategy. We have workforce support, advocacy, and then the faculty as a leader in this in climate change and health, and also as an organisation to achieve net zero. Just very briefly on supporting the workforce, we have a programme of events which includes an annual post-COP event, which is always very popular. With colleagues, we've changed training and CPD policy. We have a new website. We have an increasing number of case studies that can be used for a resource. And I should point out that, as Kevin mentioned earlier, we have a committee and a specialist interest group. And it's a specialist interest group where the energy and the ideas come from, and the committee oversees that. Particularly some very interesting work going on reverse mentoring. And Maria, who's going to follow me, I'm sure will be able to talk more about some of the advocacy work that's going on. But I'm very keen that we work with partners, particularly Association of Directors of Public Health, the UK nation. So there's a lot of learning and work that we've done supporting colleagues across the UK, and in particular learning from, I think, for example, the road strategy in Wales and in Scotland, the recent health, sustainability, and climate change framework, all of which is important learning that we in the faculty can share across the UK. Then finally, the faculty's role. And I'm pleased to say with board leadership and leadership from Kevin, we've been able to change our investment policy. So we have an ethical investment policy which moves away from investing in fossil fuel. So we don't invest in fossil fuel, but we promote green policies and green investments. We've looked at carbon reduction across training, our meetings, food provision, for example. And then we have a very active partnership with the UK Health Security Agency, the National Health Service, the Department of Health through the Office of Health Improvement and Disparities, UK PHR, universities, a number of other key partners. And working on net zero, just one final point, I'm going to get into trouble by saying this, but I am very excited that some incredibly important work has been done by some colleagues, Kat and Julian in particular. We have been involved in an annual organizational audit to look at a range of our activities, calculate how much carbon that we produce, but also what actions we put in place to reduce that. And we should have some good news to say this coming week, Kevin, but I'm going to get into trouble to say that actually across all faculties and Royal Colleges, we come joint top. And we've also done some work on offsetting that as well. So potentially we can declare ourselves already a net zero organization. However, there is still lots to do and we shouldn't depend on offsetting, of course. But I'm delighted to say that and all of that is done with a range of colleagues across the specialist interest group and the committee, one of whom is Maria van Hove, who is, I know, going to speak next. So Kevin, just a quick reflection and a couple of questions for Maria as well. Thank you.
Fantastic, Paul. Thank you so much. And yes, you've stolen my thunder, but I'm really happy that you have, because we're all so proud of our journey to being net zero here in the faculty. So fourth and final panelist, thank you, Paul, is Dr. Maria van Hove. Maria is one of our public health specialty registrars. She's a physician and she's currently based at the UK Health Security Agency. Maria, we're always keen to hear from the next generation of public health practitioners and consultants about how you're viewing this public health challenge and what you uniquely see your role will be now and in the future. So Maria, your thoughts, please. And then.
Yeah, sure. I mean, clearly climate change is going to be the defining issue, I think, of my professional career and my colleagues' professional career at the sort of same stage. And I think this is why it's so important to first of all, increase the impact that public health professionals have at the moment in working on mitigation and adaptation to climate change, and increasing their confidence on translating the science into action through education and training. And this is one of the things that the SIG is doing. And I think the other thing that is really important in this space is to ensure that public health professionals in the UK are well equipped to work in a changed environment in the future. We are going to live in a vastly different world where maybe tropical diseases in the UK are normality, where we might see things like dengue or West Nile virus in London and in other parts of the UK, and where we might see more extreme weather events, flooding, heat waves, etc. And this is something that we need to prepare the public health workforce to be able to deal with through equipping them with appropriate communication techniques and making sure that we have a training program that matches the sort of challenges of the future. I hope that answers your question. I also wanted to reflect on one thing about what from Maria Neira's talk on the sustainable elite, which I think rings very true with public health professionals. This thinking that people who are well off are first of all better able to adapt climate change, but they're also able to have a lower carbon footprint through the finances, through the better financial situation, their background. And I think this is something that public health can really where public health can really advocate for and have a role in highlighting that and making sure that a transition is just and that we don't leave the most disadvantaged of our societies behind in transitioning to a low carbon future.
Wonderful. Thank you so much, Maria, for that. And you're absolutely correct about, I'm glad that you brought up the issue on the global elite or the climate elite, as Maria had mentioned too, because that struck me as well. But also remember that I think it can operate in both ways. What we found certainly in the ULEZ expansion, some of the resistance to some of the climate efforts came from the more green, leafy parts of the city who were not willing to make some of the changes that were necessary as well, or didn't see it as their problem. So that challenge of segmenting our populations and communities, know what matters to them, and then helping them along the journey, I think is key. So we're going to bring all of our panel members back on screen, as well as Maria. Maria, just before I launch into questions, I don't know if you had any reflection on what you've heard, Maria Neira, on what you heard from the panelists and the respondents.
My reflection is that I'm very excited to see that everybody's engaged, contributing, very much aware and ready for it. Of course, the road now to COP28 is filled with many important events, and Paul was mentioning the World Health Assembly. We need you all at the World Health Assembly, not necessarily physically, but because that will be important. But as you know, we have an important resolution on climate change and health. And then, and this is a scoop for you, because nobody knows yet, we will have a special briefing on climate change and health. Well, I'm sure that everybody will disclose this information now, but it makes us very pleased. So we need to prepare something very strong. And in addition to that, we will have a consultation with the health network on how to engage on climate change. I'm looking for the dates now. I'm sorry, but I will send it to you, Kevin, for distributing to everyone. I think it's in June, but I don't want to make the exact day, but we need you on all of that. So the resolution is critically important. The GPW, which is the Global Program of Work of WHO, is now prioritizing climate change and health. So you need to work with your ministers, with your governments, for them to support that and to support financial assessment as well, because you know, we are a priority, but we are not a priority for financial support. Again, and a scoop for you, but we need to move on all of that. And of course, the reflection to my dear friend Mala, woman, for me, it's obvious that maybe I for that reason, I simply omitted to give a special emphasis to that, but it's definitely extremely obvious that not only women play a role, but they are the ones suffering, and probably the ones that they will not promote themselves more on obtaining results. So we need to do that for women as well, and we need to make sure that they are all very much involved. Lovely to see all the things that are going on, Maria and Deborah. Lovely to see you all and to see that passion, and I see that we share that, so that's very contagious, and I'm very happy to hear that climate change can be contagious as well as a virus.
It most certainly can. All right, so colleagues, we're going to do rapid fire question and answers now. I'm going to ask two of you randomly selected to answer a question, but if you could do a brief answer, we'll get through as many as we can. So Deborah and Maria, first question is on mental health. Are we making the connection not only with physical health and mortality, but actually mental health and economic productivity and participation in society? Are you doing it locally, Deborah? Maria, is mental health a winning argument? Deborah, let's start with you.
Yeah, absolutely. We're thinking about, we know the design of the environment. We know that access to nature and biodiversity is really, really good for people's mental health as well as the physical health. And so the vision that I was mentioning when I was talking about our work in Calderdale, about what a low carbon and resilient Calderdale will look like, is one that will be, you know, really important for people's, maybe even more important for people's mental health than the physical health. Designing areas where people connect with each other, for example. You know, we know that where there's fast moving, lots of vehicles on streets with fast moving traffic, that people are less likely to connect with the neighbours, for example. So absolutely.
Great, thank you. And Maria, what do you think? And
The same that as Deborah has described, you can extrapolate it at global level. Of course, climate change is affecting and will be affecting a lot mental health. So we are working very much with the director of mental health and putting in place. But the benefits of tackling the causes of climate change can create a space that will protect a little bit more our mental health. So totally mirror what Deborah has said. Thank you.
Wonderful. All right, next question then for Mala and Maria van Hove. And this is one on how do we link armed international conflicts? We're in an increasingly an environment where we're seeing more conflicts happening internationally and climate change. Is there a space there for us as public health practitioners, knowing the impact on food insecurity, air pollution, population migration, and movement to really link this? Mala, what are your thoughts here? Maria, what are your thoughts?
Well, Kevin, thank you. You know, when it takes me back to, I think, the year 2000, when I was asked to write a book chapter on health impacts of climate change, and I put them into primary and secondary and tertiary impacts. And in the tertiary impacts, I said, climate wars and water wars and so on. And I was asked to remove it because it was deemed too scary. And yet Oxfam, once the Sudan conflict began, wrote a very good report, a very thoughtful analysis, which showed that it was pastoral communities fighting for depleting water resources in Africa, which was causing that. There is an absolute link, and it's interesting that fast forward to today, and people are more less uncomfortable. No one's comfortable, but less uncomfortable in terms of recognizing that conflicts are happening because of depleting natural resources, and that communities are suffering as a consequence. But we're still helpless as to how to manage that. As I mentioned, it's UN statistics, 80% of climate migrants are women. And you can imagine the sexual violence, everything that they are experiencing as a consequence of that. We don't have solutions, and that concerns me greatly. There's no doubt about it. We need to acknowledge it. We need to talk about it. We need to ask our governments to acknowledge it and put that at the as one of the reasons why they may get engaged in conflict resolution around the world. And the solutions may not just be arming one side and not the other, but it might be something more fundamental, like looking at what climate impacts are going on in those countries and war zones.
Indeed. Maria van Hove, from your perspective as the future leaders of the public health profession, how do we connect these agendas?
Yeah, I mean, this is such a hard question. So I think and so relevant for public health because of the potential for significant supply chain disruption when it comes to food, when it comes to medicine. So there's a huge adaptation need here, but also when it comes to potential refugees, we really need to make sure that we have really good refugee health within the UK, and we don't fall into a populist trap and trying to keep people out that are fleeing horrible circumstances. I think internationally, we need to ensure that we do our part to stop extractivism when it comes to conflict, that these international conflicts are resolved, or, these international challenges with supply chain and food shortages and so on are resolved in a way that doesn't mean that the global north just, continues in their normal way of living and puts the burden on the global south. And I think within the UK, we also need to look out for the poorest in society and ensure that, wealthier people can't just buy their way out of the crisis by continuing to access healthcare, continuing to have, varied diets with fruit and vegetables, and the poorest in our society bear the brunt of this. We're going to explore the connection between conflict and climate change a little bit more in an upcoming talk between the special interest group on climate change, the special on sustainable development and the special interest group on conflict. I'm really excited to see how that's going to turn out, because this is such an important, and as Mala said, really difficult issue.
Yeah, and thank you, Maria. It was purposely a difficult question to you, because I think it's the sort of thing that we grapple with in public health, because there are multiple concurrent threats, and the tendency to want to focus on each threat as a silo rather than looking at their interconnectivity, their interactions, the co-benefits, means that we may be missing a trick. And it also means that we're not enabling people to understand the complexity in a more holistic way, right? So that what they choose to eat may have an impact on the climate, which may have an impact on global conflicts. Now, it may be too much, but is there space for us to begin connecting those silos and those conversations? I think that must be part of the challenge over the next decade. All right, we're going to end then with the final question that we'll hear from each of the panelists very briefly before we close. Progress towards our goals is never linear, right? The journey to whatever we're working towards is not a linear path. There are going to be blocks along the way and things that we need to overcome. I'd like to ask each of you as we end to think about the one thing that you may be worried about that may hinder our progress towards our goals on climate and health, and what thing you think as public health practitioners, the faculty, we can do to mitigate that barrier. Okay, so yes, we all want to see change. It may not happen. How do we overcome that barrier? So I'm going to start with Paul, and then Maria Van Hove, Mala Rao, and then Maria Neira. We're going to end with you. Paul.
Okay, thank you, Kevin. I think one of the barriers could well be the perception that the fossil fuel industry is working behind the scenes on preventing what we want to do. It was mentioned earlier, Maria answered it very eloquently about the role of fossil fuel in COP, but I think we just need to be really alive to the perception, even if it's real, and if it is real, we must deal with it, and if it's not real, we must deal with it as well. And I think the way around this, I think, is good communication and just simply counter the arguments and just hold the course and keep going. I think there's a lot of learning, as I mentioned before, from the past. So that would be my main barrier and how we overcome it.
All right, brilliant, Paul. Thanks for getting us started. We have 4 minutes left. So Maria Van Hove, Mala, Deborah.
Yeah, so I have two things. The first thing is what I worry about is backlash from the public if we don't ensure a just transition, and that's both true at a national level and at an international level. With particularly at the interface with politics and populism. And the other thing is my worry is that the situation is getting so bad that we are so embroiled in firefighting that we don't manage to do the more longer term reductions in emissions and adaptation. And because we're so caught up in dealing with the acute emergencies. But I have to say that Tim Lenton from Exeter University has done some work on positive tipping points, which is really giving me hope. So positive tipping points means are these crucial changes in society where suddenly something becomes goes from being niche to being generally accepted among the public. And that work that work shows that we can really move quite quickly once we hit a critical mass. So I'm really hoping that there will be a lot of positive tipping points in the near future.
Fantastic, great. Mala and then Deborah.
Yeah, thank you, Kevin. I was thinking 57% of our child and adolescent psychiatrists in England, even by 2020, were seeing referrals of children and young people because of climate anxiety, specific referrals on the climate anxiety issue. And we also know that another survey showed that they were more anxious about the climate than the pandemic during the pandemic. So this was a survey that happened at the height of it, 2020 or 2021. And my concern is that there is a big barrier between us adults and our children and young people. They're getting more and more anxious. They're feeling more abandoned. Maria rightly pointed out we need to do something for them and make them feel hopeful, but they're not going to be tricked. We can't just say be hopeful. We've got to show action. So the barrier is that we're not understanding them. We're not bringing the two sides together. And I think in public health, we have a massive role to play, and we're also well placed to do it. So please, my plea is, let us in the faculty start this movement of bringing the two sides together and demanding action on behalf of our children and young people, and therefore also demonstrating to young people that there is going to be a hope-filled, good life for them to lead in the future. Thank you, Kevin.
Fantastic. We have a final minute left. So Deborah and then Maria.
Yeah, a lot of my things have gone already. Perhaps I think sometimes the point about looking at climate change. So, for example, with food, I've challenges around the battle between food poverty and sustainable food, and understanding really that these things have the same roots. The roots are the same. So I think it's the separation and competing, trying to make climate and encourage narratives that are climate change competing with the cost of living crisis, with poverty, etc., when absolutely they have the same root causes.
Indeed. And, we've discussed some of these today. Maria, we're going to close the lecture with your reflection, your challenge and your hope.
Well, challenges we have plenty. The competition among different tragedies that we are suffering now. I mean, war, conflict everywhere. So people might tend to move from a tragedy to another. So that's one. Second, the justice. As Maria was saying, we need to make sure that we are responding to the needs of those who are not responsible for the emissions, but as they are suffering most. And of course, the private sector, as Paul was saying very well, and Mala. So those are the big obstacles. Now, Martin Luther King used to say, "I have a dream," that famous sentence. I'm afraid here we need to have a dream and a plan to implement it, and the tactics to do it, and then very, going around the different opportunities we have. And for that, again, we need to keep our population with us by demonstrating the health benefits and keeping the youth, as Mala was saying very well, motivated and proving them that this is feasible, and we are obtaining little battles or little victories and keeping announcing and displaying those victories with mayors as well. Mayors can be our supporters because they can show the citizens and then they can get more votes for that. Thank you.
All right, Maria. Well, colleagues, thank you so much. This is the end of our distinguished lecture, and what a journey it has been. Please join me in thanking our speaker, Maria Neira, for her wonderful introduction to the climate and health discussions, debates, the future challenges and priorities. And I'm so pleased we had such a diverse and interesting group of panelists who joined us. Our next distinguished lecture will be on the 7th of June, and we'll be welcoming Professor Linda Bold, who's a professor of public health at the University of Edinburgh, to speak about her work on commercial determinants of health, which indeed are going to be linked very closely to the work and the discussions that we've had today. What is the evidence telling us about the commercial determinants of health, and what are the opportunities for public health in the 21st century? Thank you so much, everyone, and look forward to seeing you again soon.
Thank you all. Thank you.
Bye, Maria.
Amazing speakers. Thanks.